Welcome to Elixium Podcast, where health is personal, meaningful, and lasting. We go beyond quick fixes to uncover the root causes of how you feel so you can take control of your health and your future. All right. Hello.
Hi.
We will go ahead and just get into it. So before we get into the science behind your philosophy and how you work, what first made you realize that healing is simpler than we typically think?
That's an excellent question. And I think it's come from an amalgamation of experiences, but the most potent one was when I was going through my own health experience. I often describe to people that most health experiences come from an accumulation of what's called allostatic load. It's the overall load that your body can handle. This can be an emotional load, it can be a physical load, it can be a chemical load. My body was dealing with all of those. I was injured, I was dealing with something stressful, and I had had a mold exposure. And during that time, I had all these great practitioners, and I was studying functional medicine, and we were trying all these supplement protocols and doing all these things, and I kept getting worse. And talk about like a spiritual crisis at the same time, because it's like everything that I've been studying for the past couple decades like isn't working. What's happening? And it was this realization that I needed to do less, and that with what was happening in my body at the time, working on the mental body was actually significantly more important than working on the chemical body or the physical body. The physical and chemical body weren't able to do their jobs until the mental body was in order. And so then when I really started focusing on that one particular need that the body was asking for, that's when everything started to turn around. And it was less supplements. It was bringing food back in. It was all of the opposite of the things that I was being told to do, even by the less conventional system, right? So I've worked with a lot of people that have been through these healing journeys where they've been through the conventional system and it doesn't work. And then they've been through 10 holistic doctors and it also doesn't work. And so I tend to be the last resort that they run into, because I've learned these nuances of the simplicity of helping the cell heal, and that more isn't always better. It's about the right things at the right time.
Interesting. Okay. And you talk about the chemical, physical, and mental. Chemical, physical, mental bodies. Explain that to me.
Yeah. So to me, this is the foundation of holistic care. My background is very heavy in neuroscience, and then my doctorate's actually in chiropractic. In chiropractic philosophy, we talk about thoughts, traumas, toxins. These are the things that disrupt the body. It's the most foundational philosophy. So when we apply that back, it's like, well, thoughts, that's our mental body. Traumas, that's the physical body. Toxins, that's the chemical body. But putting it into a language where like, oh yeah, I am actually working with that. So the physical body is when you get injured and you need to maintain something. This is when people come in for physical care. If you get into a car accident, your body's going to be working on healing that. And you're not going to have as many resources to deal with your stress at work or your stress in your relationship or your stress at home. So helping people understand the differences between these, you can realize when one is overloaded. So if you injure yourself, you know you're not going to be as emotionally resilient. If you're incredibly stressed out at home, it might not be the day for you to pound fried food and a beer. And so it teaches you like, well, where's my capacity right now? And if it's going towards that fight with your friend, then it's probably not the right thing to eat all the sugar, even though you want all the sugar. And so if we can learn to let our body focus its resources on these things, this is how we create sustainability. Because then, let's say you went through what I went through and you get a mold exposure, you then understand why you have to be so much more careful with your food than the average person. And it's because your body is maxing out its allostatic load. And this helps people be less resentful of their healing journey and feel more empowered and more in control of the entire thing. Because they're like, oh, well, I can't have cheese because my body is already working on this inflamed thing and I'm going through a breakup. That's a lot. I'm just going to not eat cheese this week. And then all of a sudden it turns into an empowering decision instead of the victimhood that I find a lot of people tend to live in when you're going through a health crisis, which is understandable because it's really scary. And most people totally do not understand what you're experiencing or what you're going through, especially when your brain's not working, when you're inflamed and stuff. That's even scarier. And then you don't handle your emotions as well. And it becomes this whole cyclical cycle. But if we can help people feel empowered in their decisions again, the healing goes so much faster.
That makes sense. And I think you hit it on the head. I think it is cyclical because it tends to be you're stressed out at work. I'm going to go home, I'm going to have a couple cocktails, and then, I'm going to stress eat until midnight tonight and overthink and it's just like this pattern that it's like, where does it start, or where did it start? And with that said, in your practice, do you feel like it tends to start with mental first, or could it be any of the bodies that it could start with? I have an injury, then the injury then causes mental fatigue or something cognitive, and then it kind of just, it's that waterfall effect.
I think it can be any of them.
Yeah.
Proportionately in our society, I'm going to go with the mental body gets stressed out first, because we are living in a society that's no longer designed for our biology. And so everybody's stressed out, which is why mindfulness practices are so important these days, is because we're not dealing with the same world our grandparents dealt with. Like, we have so many more inputs and things that we're managing, and pings and dings and messages and alerts, that our nervous system is just always kind of wired from that. So it's really learning how to pare that down. And then when you look at how stress affects things, like if you study people like Gabor Mate, who's one of the fathers of understanding trauma and the effects on the body and has a history in medicine, he basically wrote a whole book about why certain personality types get autoimmune disease. And it's because your brain is sending certain signals to your body. And this is what I think people totally forget about in a lot of conditions, is it's like, you can throw supplements at it, you can do all the things, you can eat the right food. If the signal from your brain is still, we're under attack, your immune system is going to respond in the way of, we're under attack. So if your brain is thinking we're under attack by the universe because you've just been jaded so much from your life experiences and haven't done the shadow work to reclaim your faith again, then that signal is sent to your cells, it's sent to your immune system, and it's sent your body into a breakdown state. So you can give it all the supplements and nutrition you want, but if your body is chemically and hormonally in a breakdown state, it's not going to do the right things with that nutrition. So I often start with the nervous system first. Like, I had a gal come in, and she has been struggling with weight loss for years because of some early childhood stressors, like significant stressors. And she went through bad experiences in the conventional system because everyone told her she was lying about her food. She wasn't. I tracked everything. We took pictures, and her body was just stuck in a fight or flight state from those early life experiences. And so there's no point in giving her nutrition and trying to work on that stuff until we actually opened the cells up, because when they go into that sympathetic response, they actually go into what's called a cell danger response, and they kind of tighten up their lining, and they can't release toxins and they can't absorb nutrients. And so we did some physiological work to get her nervous system balanced. And once it was balanced, then she was able to absorb nutrition, and then she started losing weight. And then she had a stressor came back, and we hit a plateau with it, and her weight went back up. And then we moved through the stressor emotionally, and then it went back down. And so it's been like, it's such an interesting experience to apply this stuff in clinical practice, because like, you always have the research and everything, but nothing's the same as watching people actually go through something and then having to modify it based on different people. And like, even like our anatomy is different. I used to work in a cadaver lab, and I can tell you there's so many people that don't match textbook. And I think that goes with emotions and chemistry as well.
Interesting. Okay. So when you take on a patient, do you typically go, is it more like meditation style at first, or it's probably dependent on the body that you deem is potentially the root cause?
It depends on each person, and it depends on where they're at. Because if I get some super left brain hyper research engineer, we're not really going to be able to talk about chakras on our first appointment. Sure. And so for me, it's about talking to them in their language. And if they're coming in and they're like, I have pain here, even if I know a lot of that pain has to do with metabolic stuff, I'm going to get rid of the pain that day, because it builds our relationship. And then we can have different conversations where I'm like, okay, Bill, like, we've been seeing each other for a year now, and you're still having pain in this area, even though it gets better every time we work, but then it comes back. How would you feel about maybe drinking less? And then we can have that conversation, because I've built up rapport by working on the other stuff first, versus if that's our first conversation, doesn't always work. And I think this is a huge difference between alternative care and conventional care. Conventional care, you walk in, and even when I've been seeing my doctor for 10 years, they still ask my name. And so versus having him come in and we hang out every couple weeks after his golf game and after his whatever, and we chit chat and we have this relationship. And then I can be that one of those trusted people in his life when maybe, his children are grown and he's divorced and he doesn't always have that other person to be supportive, being like, hey, I've watched these things and I've noticed this. How would you feel about doing this? And I'll be here to support you. It's like a totally different experience for people.
Yeah, that's fair. And do you do like personality tests, or is it just something instinctual that you have that you're like, okay, I know how this person.
Yeah, you can do personality tests. I know some practitioners that do that and can be really great for like motivational coaching and stuff. For me, I ended up randomly getting trained in subconscious techniques. I never dreamt that they'd be a part of my practice. And they're like kind of like light hypnosis techniques. They're all a little different, mindfulness techniques. So I do like neuro-emotional technique. I've known that one for years. And rapid rewire method is another, neuro-linguistic programming, Psych K. And all of these are different techniques that you're just like talking to somebody and you can bring up the emotion or bring up whatever they're experiencing. And then you have all these different tools to work through it. But it's not like therapy. You're not going around and talking about the story. You're trying to work out some story from decades ago. You're talking to them about a feeling and then you're working on transforming the feeling. And this can come in a lot of different ways. But I think in doing that, what I love the most about all of those is that they are very question oriented. So I don't necessarily have to like analyze someone's personality and then present to them what we're talking about in a way that I think would match their personality. I'm more just asking them like, well, what do you see? Like, what does this mean to you? Like, if it's going to be represented in a way, like, how's it represented? For some people, it's like a younger version of themselves. For some people, it's a cartoon character. For some people, it's a color. And then we just work with that color. I'm like, okay, great. Like, what does this gray cloud need to feel safe? And then we have that conversation and you work with these subconscious parts of the psyche to help them feel safe. And you can literally start to help someone reintegrate like fractured parts of themselves without ever going into the story or ever talking about the 20 years of trauma from whenever. And I have therapists that I refer to. So that client that I talked about earlier with the weight, like she has a therapist that she works closely with, but we do different stuff. And so I'll help her kind of pull out what's hidden, and then she takes it to therapy to go work on. And I love that model for people. But yeah, it varies person to person. But I think if you're just really focused on asking someone's questions, you're going to end up finding out what's valuable to them. And I think most practitioners don't ask enough questions in the first place.
No. Yeah, definitely not. Definitely not. Yeah, that's something that we've been really trying to focus on is like what the patient's why is, like what's their motivation to change.
Most of them don't know.
And that's the thing is in most cases, it's like, well, I put on 15 pounds of unwanted weight and I want to change that. But yeah, it needs to go back to something deeper than the 15 pounds. Like it's truly like, why do you want to make a lifestyle altering change? And you need to know that in order to commit.
Well, one of my favorite questions in neurolinguistic programming that anyone can ask themselves at any time is they say, okay, this is the goal. And the question is, okay, well, what would that give you? So like, if, for example, for anybody listening, if I were to ask you, so you have this goal of losing 15 pounds, what would that give you?
That's interesting. I like that.
So yeah, then their response will usually be like, oh, I'd fit into my pants better. I'd feel better about myself. And I say, okay, well, what would that give you? Say, well, I feel better about myself. I'd be willing to go out more and then I might be able to hang out with friends more. Okay, well, what would that give you? Oh, well, that would give me community and that would give me joy. And then all of a sudden I wouldn't be thinking about my weight so much because I'm not lonely anymore. And then I wouldn't feel isolated. Okay, well, what would that give you? And you just keep going down that path. And then you realize what kind of life you actually want, which most people haven't thought about because many people are focused on surviving, which is, what do I need to do tomorrow? I need to pay this bill. Where do I need to be? What time? Blah, blah, blah. And that's why I encourage people to go on vacations. Like part of my care for people is often recommending that they go take a vacation. And it's just like taking some time to not have to worry about where you're going to be in 20 minutes and just be in your body and eat when you're hungry and sleep when you're tired. And most people don't allow themselves to do that and forget that that's the life they're trying to get to.
That's true. Very true. Okay. Love that. You say healing is simpler than we think. What do most people get wrong about healing?
Faster is not better. And I think when people are sick, all they want is to heal fast. And I totally get it. But I spend a lot of my time reversing care that people have either done themselves from internet fads or from practitioners that don't listen as intently, that have overwhelmed the liver. Usually is what happens in people. Our livers are already very taxed from our world, but people will see like this parasite cleanse on the internet and they'll be like, I'm going to do a parasite cleanse, and then they feel terrible afterwards, and it's because their liver was not ready to handle that. People forget that you have like a backlog, right? The liver is a drain essentially, and it has to, it's a really cool system. Basically, like you absorb stuff, it goes through your body, and then it goes through your intestine, then it gets back into your bloodstream, goes through your liver again, and then goes back into your intestine again to be released. So your liver is like this catch-all, and we used to joke in class that it's like the organ that needs a pay raise because everything goes to it. But a lot of people, like a lot of these cleanses, so can I get sciencey for a second? Okay, cool. Sure. So if we talk about like detox phases of the liver, right? Phase 2 basically runs on amino acids. And then you'll have all these people that are doing a fast and a cleanse at the same time. So they're not giving their body amino acids, which you need to run the drain of your liver, at the same time that they're putting stuff into it. And so you create this huge backup. So you need to be consuming amino acids if you're going to be doing a detox, or you need to not be completely pushing detox if you're not consuming amino acids. And it's this balance of these things that I think people don't talk about as much. And the amino acids, basically like glycine, taurine, glutamine, those are the big ones. They unclog phase 2, drain of the liver. This is where everything can kind of like move out. It's where things become water soluble so we can get them into the bowel and out of the body. The other thing is that people will do a cleanse when they're not pooping. You cannot cleanse the body if you cannot get it out of the body. So you have to make sure it's getting out of the body first before you put anything else in the stream. So getting out of the body first, unclog the drain in the liver. Now you can actually push the initial detox phases. And their immune system has to be at a tolerant enough point that if you push their liver, it's not going to create an immune response. So there's these nuances to doing detoxes and stuff that I think people skip over. But if you can understand those, it makes everything a lot safer and gentler and more successful. Because if you just try to push everything to the liver all at once, you're going to shred your liver.
Yeah. We've definitely been learning that through, because the gut has been a little newer for us as far as that's the route that we're going. And
they're not separate either.
Yeah, no. But the liver seems to be like the key component prior to putting people on gut protocols. So that's what we've been doing a lot more research on is, okay, if the liver's the first, then we need to, well, one, test the liver because we want to know where liver enzymes are at. And then second to that is, if liver enzymes are at X, we obviously need to make sure the liver can handle the potential gut protocol that we're going to put them through. So it's something that I personally, I didn't think about. I'm not a physician, so I didn't think about it at all. But yeah, my physician's like, we need to make sure we have a liver protocol before we start these gut protocols. And I'm like, perfect.
Hugely.
We need to develop that. Yeah.
Hugely. And I think if I put in one more sciencey fact for the people listening, so people will look at liver enzymes as their main liver marker, which is great, but stuff can be missed with those. And so I make sure to look at bilirubin, the output of the liver, right? And then also looking at triglycerides. And I think bilirubin and triglycerides are significantly more important markers, especially when you mix them with homocysteine for any kind of cardiovascular health than cholesterol. And so I'm just going to put that out there so that when people are listening and they're like, oh my God, I have high cholesterol. It's your fire department. It's like a fire engine running around. So if you have a fire engine running around, don't like boot the fire engine and get rid of the fire engines. Figure out where the fire is. And I remind people of that because it's like, if you see triglycerides building up and the liver enzymes are okay, then I'm like, okay, like there's some kind of fatty liver happening. There's some kind of backup, and like there's going to be an issue if this isn't fixed. And that's how you do preventative care.
Yeah. Find the fire.
Yep.
Not the fire engine, for sure. Triglycerides, explain triglycerides to me.
Sure. Triglycerides are basically what your body does when you have a certain amount of sugar in your bloodstream. And so it starts turning it into fats. And then when it needs a place to store it, you'll either store it in adipose tissue or your liver. And so you get backup fat in your liver for quick energy because our body thinks that we're still having states where we fast sometimes. So when you do fast, That's where your body's pulling from, is like glycogen fat stores in your liver. But when we get too much stored in the liver, because the cells are like, I can't handle any more of this sugar, I'm now going to put out insulin resistance. And then the body's like, I still got to put this someplace or else I'm going to poison the bloodstream. I'll just shove it into the liver, puts it in there. And then all of a sudden the liver starts to kind of get backed up because it has all this fat stored in it and it just doesn't work as effectively. And so that is why fasting can help people in these states. But if you have a liver that's totally backed up and you've had some kind of toxin exposure, like heavy metal exposure or something, and then you go straight into fasting, those are the people that tend to have a little bit of a rough detox. And I try to aid them with making sure there's phase 2 support and then listening to their body along the way. And this is where like muscle testing and stuff can be really cool, which is not necessarily as objective as a lab measure, but at the same time, labs can miss things. And so muscle testing can find those. And so I like mixing all these modalities, and you can put someone on a certain vitamin regimen, and then you can have them come back in. You can literally muscle test and ask their body, how are you doing with this? And their body can be like, this is too much, or actually I need more of this. And so it can be a nice way to like help someone's system listen dynamically as they're going through the process.
Gotcha. What is muscle testing?
Sure. So muscle testing.
I'll just keep asking follow-up questions.
I love it. Yeah. So muscle testing is a fairly old technique, and it is basically using the body like a circuit board. People forget that we are electrical systems. We are electrical circuits. And so muscle testing is basically using the electrical nature of the circuit, much like flipping breakers on a house and like seeing what light switch isn't working, right? So there's a lot of different forms of it. You can do very direct muscle testing. Like I'll test certain muscles. I'll see if that muscle's firing. If that muscle's not firing, I'll go trace down the nerve. I'll figure out why is it not firing. And then if I can get it to fire with structural work, then we won't do something like dry needling and additional body work. But if I fix the structure, I fix the nerve and the muscle's still not firing, then I can go in and do some other kind of therapy to it. That's like direct muscle testing, or like orthopedic tests, right? Like if you push down on the arm when the elbow is, or when the shoulder is flexed, that's C5 classic. So if someone turns their head and all of a sudden that muscle can't fire anymore, it means C5 on that side needs some care. And so those are direct muscle tests. But then you can get more woo-woo with it, we'll say, and you can basically do frequency testing. So in my office, I have vials that have been homeopathically imprinted, basically meaning frequency medicine, to match the frequency resonance of different enzymes and vitamins in the body. So you can go through and I can literally test enzymes in the body energetically and ask, how's your body doing with this? And sometimes the body will say, hey, this pathway is stressed. I actually need more B12, or I need more folate. Or actually this pathway is overtaxed. We need to stop the vitamin D because that's too much vitamin D. So you can actually, and like you can test that on a lab too, but labs are expensive. So this is just a way people can come into the office and I can do stuff. And it's, I know for all the skeptics out there and the left brainers, trust me, I get it. I have been one. I've worked in research. It took me a long time to understand and wrap my head around. But then after working in tons of offices and performing it and having it continually match up with lab tests, there just comes this point where you're wondering why you doubt it. And then like why we're so against frequency medicine when it works so well. And then you can go, there's a lot of history I can go into around that about things that got banned in the yeah, it is
form of medicine.
It is the oldest, and there's a lot of things that got banned in the last few generations at different times. That's a whole other conversation. But basically, like muscle testing is one of the oldest things that we have around, and it's basically just asking the neurology of the body, and it's asking someone's body questions. And as a practitioner, some of the times I've regretted the most are when I've ignored the muscle testing. Like someone will test like kind of edgy to a supplement. I'm like, it's innocuous, like it'll be fine. And they just react poorly to it. And yeah, so it's fascinating. It's very humbling as a practitioner.
So you would do the homeopathic frequency, it's homeopathic frequency enzyme?
Yep. So I basically just have a vial with that in it, and then I'll hold it against their body, their magnetic field. And then
you just hold it against it.
Yep. Because magnetic fields affecting magnetic fields. And then you can use what's called a facilitator muscle. So it's a muscle that has previously tested strong. It's doing a certain kind of output, like we've done a control check on it. And then you see if that output changes when this enters their field.
No kidding.
It's fascinating.
That's insane.
Yeah. And it works really well.
And then if it's weaker, there's either an imbalance of some sort.
Yes.
It's either too much or too little.
Yes.
Do you know how much, like if it is too much or too little based on the outcome of the test?
Yes, you can figure that out. So basically, I have an old mentor who's actually up in Longmont, Dr. Alamong, and he came up with this kind of way of muscle testing where it's like a negative muscle test. So you find a weak muscle, and then you hold something in someone's field and you say, does the presence of this so helpful to your body that it actually makes this weak muscle strong? Because when you really want to get woo with it and you go into quantum physics and stuff, the body is a hologram, which is why things can change instantaneously. You put something in your mouth and all of a sudden you have things going on in your intestines that logically are happening faster than time would allow if you start to do those research studies, or, nerve reactions happening faster than the nerve pathway can fire, that kind of stuff. But when you hold this against someone's system, their biofield reacts to it. And then you can see, well, would the presence of more of this actually strengthen that muscle? Okay, great. So we need more. So then you can either have them hold it in their hand, hold it in their mouth, but then you can test the number of capsules. You can be like, okay, so we have, 1 to 5 of these capsules in your hand. You're strong with 1, you're strong with 2, you're weak with 3. Okay, great. 2 is what your body's asking for right now. Again, that's a much more subjective approach, but if the recommended amount on the bottle is 6 and their body is testing for 2, you may have just saved that person an over detox.
That's insane. So you can dose.
You can dose.
That's
yep.
insane. Okay. So with that said, like magnesium is like the biggest thing right now.
Totally.
What are your thoughts on magnesium? Just because I guess the science behind it, whenever anyone talks about magnesium, is one, most people like 70% of people are probably deficient in magnesium, and it's hard to overuse magnesium is the thought process behind it. What are your thoughts on magnesium, just as magnesium, for those reasons?
Sure. So people forget there's about 7 to 10 types, and I know a lot of people are like, this is so annoying. Can I get a supplement with all of them in one? And like, you can, but that supplement's a little rough on your gut because it's kind of unnatural to have like all of those types together that compounded. And so we have to remember that food is medicine and the body is always going to respond to things in the doses that's normal from food. The reason magnesium has changed in our food system so much is because our agriculture has changed so much.
Stripped it.
Yep, completely.
Which is why we have supplementation in the first place.
Exactly. And people forget that supplement is exactly what it is in the name. It's supposed to be supplemental to your food as your medicine. So ideally still eat, nuts and vegetables and things that have natural magnesium in it. But it's different even if you get it from an organic farm now, because even if the farm does all the right practices, the way that pesticides blow over in the wind and all this stuff, like it's just water runoff, previous farms, it like leaches the soil. So like our soil is not as mineral rich. It's not the same anymore. But like magnesium's great in a lot of ways, but there's different types for different things. So I think like magnesium malate for like muscle soreness and things like that. Magnesium glycinate for like really helping out the gut. Magnesium threonate for getting across the blood-brain barrier. Magnesium citrate if you're like super constipated. So there's all these different approaches to it. And for me, like when people are like, this is annoying that there's so many types. I'm like, no, you just have 7 to 10 tools. Which tool would you like for the job that you have? And so like if someone has really bad constipation, I'm going to give them citrate over malate, something like that. So just teaching people how to use them differently. It is a hard one to overdo. You'll know if you overdo it because you'll get a really loose stool and it's not super pleasant. So then you just do less. And so just like reminding people of that. But yeah, most people are deficient and it's used in every single cellular reaction in your body.
Gotcha. Okay.
But I will say for anybody, like, there is a reason some vitamins cost more than others. And I am a fan of making sure that you know where you are sourcing your stuff from. So I recommend buying something that has been third-party verified, usually through a practitioner or some kind of company that is associated with that.
Fair enough. Where do you typically source your supplements from? Do you have specifics?
I have specific brands that I like. Yeah, I use different brands for different things. Some people will test better to one brand than another when I muscle test, which is fascinating, right? So it's the muscle testing also allows you to see like how people respond to things. And some brands are heavier doses than other brands. So for super sensitive people, I'm going to put them on a more sensitive brand. So, and I know that's where it's like tough for people. They're like, there's so many things. What do I do? And it's like, well, this is why you can work with a practitioner. That's really helpful. And I'm working on creating more like community education for people. And I do stuff like this because I want people to understand how their body works. I think that's the main thing missing from healthcare, is teaching people how their physiology works so they can actually be independent and sovereign in their health again. And that's like my main goal, is helping people be sovereign in their health instead of giving it away and feeling like victims to themselves. And if we can learn these things, then I think people are capable of doing a lot on their own. But yes, there's lots of brands. It's a lot of learning.
It is. Yes. We use full scripts a lot, and it's constantly trying to like vet each individual brand, because just because they're on full scripts doesn't mean that's the brand that you use.
Correct. Yes. I often use full script as a distribution because it's easier for people, 100%. But there's some things, right, as order straight from the company too. Yeah.
Yeah. That's what we're going through right now for sure. What's the connection between subconscious patterns and autoimmune conditions? This is a hot topic.
Ooh, let me think about how I want to answer that for a second. I mean, I guess that actually brings us kind of nicely full circle to what we were talking about in the beginning. And the first thing I'll say is that I've been there. And I get it. I so get it. And this is where shadow work comes in. And I think a lot of people have not even been introduced to shadow work and even know what it means. Or if they even have been introduced to it, they have no idea what their shadow work is, which ironically is the definition of shadow work. It's the stuff that you have to work on in yourself that you're so incongruent with that you cannot see. So yeah, we're talking about vulnerable stuff. I'll give a vulnerable example. So one of the things I was doing when I was going through that time where my body had become allergic to everything because of the mold exposure and going through the emotional stress and everything, during that stressful time, I had realized that like part of my stress was I was in a situation where I was responsible for stuff I didn't really have control over. And I was continually shrinking myself in order to try to meet what was being asked of me. And I kept putting my own needs aside, and I kept trying to give more and give more and give more. And what I realized later, because I was frustrated with the person I was in this dynamic with, and I was mad at them, but then, and I had every right to feel those feelings, and like, yes, they had all this stuff happen in their life. But what I realized was my shadow work was that I had been overgiving and giving myself up and shrinking. And the shadow work of that is that it is manipulative in its own way. That is the manipulation of kind of like coming from an empathic, compassionate place, right? But you're still trying to get a specific outcome that is for your goal. And that means that it's technically manipulative. And so when you can start seeing things like that, then it brings it to other decisions in your life. I was talking to somebody else about this recently, and they're like, I'm an entrepreneur by circumstance. I have to be, I have no choice. And I was like, well, actually, it's very much a choice. Like you could go get a job at any point, but you're choosing this because of this lifestyle that you want. And that should be an empowering choice rather than being victimized by your own choice. So I'll bring attention to how many people are victimized by their own choices. And that goes with like the people pleasing thing. If you're choosing to be a people pleaser and then resenting people because you're doing it, you are priming yourself for autoimmune. And Gabriel Monte has gone over this, and they've done research in it, and they're basically showing that the number one cause of autoimmune is doing things that you don't want to do.
That's
right.
Interesting. Yeah.
Super interesting. So then you think about all these people, they're doing all the stuff that they don't want to do because they feel obligated to do it by society or by their family standards, because they've never actually taken a look at those and asked if that is their standard. Most people have never done the work to go inward and be like, what do I want? What do I believe? Do I actually agree with my family? Do I agree with my brother? Is this actually what I think? And like, it's hard work to do, and it's really scary because it usually starts to lift the veil of some things that like maybe you don't want to see. But at the same time, that's part of becoming an adult and like stepping into adulthood and realizing that you have a belief system that might not match everybody else's. So I think if you are resisting that, and you're wanting to stay in this place where all of your problems are somebody else's fault, then you will consistently be in the place where you are in the jaws of the tiger, because you're consistently at the will and the whim of somebody else, instead of choosing to realize that you're only in the jaws of the tiger if you consciously put yourself there, and you always have the conscious choice to decide what the next action is, even when you're in a situation where you don't have a lot of control, because your choice is your reaction to that situation. And that is like the whole concept of Viktor Frankl's book, I believe it's Man's Search for Meaning. Yeah. So if you're separated from your authenticity, I think that's the biggest risk for autoimmune.
Okay.
And you can put in, leaky gut, environmental, all the things. Like, yeah, you got to fix the leaky gut. But if your leaky gut is coming from you fearing the entire universe, then
it's chronic stress.
Yeah, nutrition won't fix it.
Yeah, chronic stress is probably I would probably say one of the number one most impacting things on the entire body as a system. So I don't disagree with that.
People forget chronic stress puts your cells into a breakdown state. It's called a catabolic state. It means that your cells are literally breaking themselves down for resources.
And think about that over decades.
Mm-hmm.
Okay.
And then the shadow work is realizing that you are the biggest source of your own stress.
Aren't we all?
Yes.
That's, yeah. Man, I could segue into so many different things from that. I know you talk about allergies a lot.
Mm-hmm.
I'll throw an example out there just so we have something contextual. So both my kids have dairy allergies.
Mm-hmm.
And I know from, like, you talk a lot in your YouTube channel and your stuff, in your content, about evolutionarily we've decreased, whether it's like microbials in the gut, different environments within our body, that we're reducing them due to whether it's processed foods, whatever it is, from generations back. And then we're now having our kids inherit these lower populated environments. Is that what is typically causing allergies in children? Eczema is a huge example. I mean, that's like, it's 9 out of 10 kids or 4 out of 5 kids, something like that, have eczema. And then dairy allergies, which, our dairy's pretty shitty anyway. So I don't know if it's an allergy to actual dairy, but what are your thoughts on that, just as a whole?
Yeah, it's a great question. I'm going to flip everybody's paradigm for a second.
Do it.
So everyone thinks of like, oh, you have an allergy. Oh, you have eczema. Oh, you have this specific allergy. You have a dairy allergy. You have a peanut allergy. You have a tree allergy. That's just what we call it. That's just the diagnosis. Eczema is basically a reflection of what's going on in your gut. Because inside skin, outside skin, same skin. It's all epithelial tissue. And then you think about what else is epithelial tissue, like your cardiovascular self, your vessels, your blood vessels, your gut, your skin, all of that all comes from that epithelial tissue layer. So whatever epithelial tissue is doing, other epithelial tissue is doing. So if your skin has eczema on the outside, probably look a little bit like that on the inside of your gut and on the inside of your blood vessels. So to me, this is like a warning sign. I'm not like, oh, this is an allergy that I have to find the right allergy medication for. I'm like, oh, this is your tissue integrity breaking down. Why? And there's so many different variables, which is why this is so hard to track. But now we know what the problem is. The tissue integrity is breaking down. Okay, so what do we do to fix it? That can be like the reason people focus so much on food allergies is it's the most controllable thing that we have in our environment. So if you are having tons of reactions, the number one thing that you have control on over your environment is putting less poison into your body. And so we should be able to tolerate dairy. That's a normal molecule. But now we have enough like weird chemicals in our environment, of which we like haven't even studied all of them. And we for sure have not studied the effect of them together inside the body, that we don't even really know exactly what's causing a lot of these sensitivities. But now we know, like, oh, like this molecule is just more irritating to my kid's body at this point. So maybe I just won't put that irritating molecule in for now until we get the rest of the irritation down. And we don't always know what that's from. And, we think about toxins that we put in our mouths, but we also don't think about the fact that we like put our kids barefoot on playgrounds in the park, which is a very normal thing to do and we should be doing, except that, oh yeah, last week they just sprayed all the grass with pesticide. And now we're absorbing it through the skin, which no longer goes through the liver, and you get a higher dose of it. So there's weird things like that we're absorbing from our environment, even like the smelly markers that kids use, right? Like that's a bunch of like pheromone, hormone, chemical
and
stuff.
They all smell them.
Yeah, totally.
Because they make them smell decent.
Exactly. So it's just like our kids are being bombarded with so many more chemicals and weird things that their immune systems are having to deal with, that suddenly they're now more sensitive to a molecule that should be normal. And so if we can kind of look at it like that and understand that, then it's not that dairy is the issue, it's that their body is overloaded with something else. And so like, okay, well, what are they overloaded with? And maybe it's the fact that we also have a whole bunch of sugar and it was just Halloween and they pounded an entire thing of candy and now they have a microbe disruption in their gut, right? So it's like your kid probably isn't going to tolerate dairy as well, like after eating a bunch of candy on Halloween or eating a bunch of it over the holidays, versus if you just had a 3-month break and then they have some mac and cheese, they'll probably do fine. So it's like, it's the capacity and the amount and what else is their body dealing with. And if they had like a super stressful day at school, even though they probably want their mac and cheese comfort food, might not be the day to feed them gluten and dairy. It might be the day to like feed them a steak. So it's, going back to the allostatic load thing. But with, with the allergies, the biggest thing with allergies is coming back to exactly what we said in the beginning. The barrier has lost integrity. So what do we focus on? How do we restore barrier integrity? Well, there's a lot of ways to do that. The most natural way with food is bone broth, glutamine, collagen, those kinds of things. Anything where it's like this nourishing, fatty, almost glue-like material, right? Same thing with soluble fiber. Like if you get soluble fiber wet, it turns into almost like this gel and then your microbes feed on it. So if we can focus on fiber and glutamine and broths and all of these healing things, that'll start to heal up the lining of the gut. If we can stop pissing it off at the same time that we're trying to heal it, it's going to heal a lot faster. So people can do their cheat foods during this time. I just remind them like, okay, well, every time you do this, it's like 2 steps forward, 1 step back. This one's a 2 step back. This one's a 1 step back. This is a 3 step back. So pick your poison, but like try to not stack them. And so I teach people that way just so it's sustainable, because getting a kid to follow a elimination diet is like hard enough as it is, right? Parents got enough on their plate. But just teaching them about this and then teaching their kids this and be like, okay, like if you want to have dairy today, you can, but that means that no more dairy until next Sunday. And then you just like build this into like their life and they just realize it as a tool. And so I think that's how to approach it. Because like I also have a dairy sensitivity. It got way worse when I had mold. I still eat cheese sometimes. I usually regret it and feel foggy the next day. And so it's just, if I do, I just know that I'm making these choices. But sometimes I like to enjoy a charcuterie board with my friend and I'm going to do that. Yeah. So it's, and then I take digestive enzymes and I'm nicer to my gut the next day. So if I could teach people anything, it's about like just understanding if there's something that irritates you, it's probably good to eat less of it. If you're going to eat it, it's probably good to not stack it. And if you're going to do it, try to nourish yourself the next day. And you should do that for anything. Just like if you twist your ankle at the gym, don't run the next day. So it's like if you're going to twist your gut on some dairy, just like don't run on it the next day.
Yeah, no, that's fair. So as infants, because both my kids came out having the dairy allergy, is that a reflection on the mother?
Ooh. Were they C-section?
Nope.
Okay. Possibly, not really her per se, but like more her microbiome. And I guess which, is a reflection for her. And if she was like super stressed out during pregnancy or she had some kind of toxin exposure, that can totally affect things too. So whatever was happening in utero.
Because they're both kids. It's weird.
Interesting.
That both kids have it.
Yeah.
But
and maybe it was like she consumed some form of not great dairy while she was pregnant with both of them, and it triggered some kind of system. And these are the things that we just like, we don't really know enough, and it's really hard to research. But for me, logically, it all comes back to allostatic load. Like no matter what you're doing, I'm like, we can research the specific chemical that's in things and all the heavy metals in your body, and we can name them all and we can count them on a lab. But when people come to me and they're like, I have money for one lab, I'm like, okay, great. We're going to run the one that tells me how to make your liver work. And so like
Mm.
we're gonna
That's the
run
first.
the pragmatic one that
Yeah.
tells me how to get stuff out, even if I don't know what it is, because
Interesting.
we don't always need to know exactly what it is. The body still works the same way.
Sure.
And so for me, I focus on like what can we do to get your body functioning, because it is designed to get rid of this stuff. It's not designed to get rid of synthetic chemicals and metals, which we're dealing more with now, which is why it's difficult for people. But overall, like it's gonna detox you better than any practitioner. Like
Yeah.
practitioner, like if you like, it's just like breaking your arm. Like you can put a cast on the arm, but the body heals it. You can give someone a supplement, but the body heals it. So if we can just focus on giving the body what it needs and trust the intelligence of nature is grander than we will ever understand. That's usually how people heal the best. And when I've seen cases that have been, irreversible, reverse themselves, it's when people do that.
Got it. So if you're running a test for the liver specifically, you're running triglycerides, bilirubin, probably ALT, AST, or no?
So
you don't run ALT, AST at all?
I will totally run those. Yeah. So like AST, ALT, GGT is one that people miss all the time for checking on glutathione and things like that. That's like your average blood test. And, people think because of the rates that insurance charges on like actual blood tests that they're exorbitantly expensive because they'll charge like $300 for vitamin D. It's actually $25.
Yeah.
And the CBC and the CMP that they run is $6.
Right.
And a GGT is like $7.
Yeah.
So just so people know, like this is what it is to do cash out of pocket. And like it can add up, especially for some of the more functional tests. And like usually someone will come in and they've had at least the basic thing like that run.
Okay.
And if they've had the basic thing like that run and their ALT and all that is normal, which those tests, again, like they give you a sense that something's off, but they don't really tell you what's missing.
Sure.
So for me, if I have one test to run,
Yep.
I like to run like a big nutrient panel because I can see patterns in the nutrients of what's happening in someone's body. So depending on how metabolites show up, I'll be like, oh, actually you have a yeast and a fungal thing. I don't know how much is there and I don't know what strains are off, but I know that your gut's off. And if that's off, then I know that the lining's probably off. And then over here, I'll look at your mitochondria. And if your mitochondria are like completely tanked and your amino acids are completely tanked, I know that you probably had a toxin exposure. And so like there's this way of looking at like how the body is using resources of like you can kind of identify what's happening for somebody, but that test is like, this is what's low, this is what's high. And I'm like, okay, great. We're going to support what's low. And then I'm going to trust the body to do its thing. And
Gotcha.
So for me, that's, if I have one thing to run, that's what I'll run.
Okay. So it's like a micronutrient panel? Is that what?
Pretty much. I run a variety of them.
Yeah.
The one I'm thinking of at the moment is called, I don't know, can I use brand names on?
Sure.
Okay, yeah, it's called the Nutri-Eval by Genova.
Okay.
And then there's, the ion test, there's SpectraCell micronutrient test, there's like a whole bunch of them, but
Yeah.
the Genova one I like, it covers a broad range. It's like a big umbrella test that covers a bunch of stuff. It's just less specific. So it doesn't tell me exactly what's wrong or like exactly the strains that are off, but I'm like, I know something's off there and that we have more work to do here. And then if I run that and we're trying to figure out what our next priority is, then I can prioritize from that.
Interesting.
So yeah.
Okay.
But for me, my priority is always what's going to give me an actionable item.
Yeah. That is super interesting. And then would you do you gut test at all?
Mm-hmm.
You do? Okay. Because I know some people are like, gut testing's, ridiculous because we can kind of determine from other testing and get actually more data based on the body as a whole, so on and so forth. I think it's bullshit because we gut test. That's what we do.
It depends on what you're trying to do.
Yeah.
Like if I run a gut test and I have no clue how their liver is working, not going to go that
Fair
far
enough.
Because then I can mess up their liver.
Fair enough.
But if I have tested stuff and it's coming back relatively normal, even like the one I just described,
Yeah.
like their dysbiosis is like a little bit off, but they're still there, especially if they're having like GI symptoms
Yeah.
or like it's worse around the full moon. I'm going to go look for parasites. But the other thing that I try to help people keep in mind is like, whether you have a virus show up, you have a parasite show up, you have a whatever show up, it all comes back to your immune system. So if you're a young, healthy person and you have parasites, my question is, why can you not clear your parasite? You should be able to clear it.
Yeah.
And sometimes you need help for like nasty ones like blastocysts or something because they like put up all these microfilms and you have to like get that off and stuff. So this is the other thing, right? It's like when you're working on the gut with people and they've been to a bunch of practitioners that put them on stuff and they still have this thing, it's because it's not being done in the right order. and people aren't using supplements to like break down biofilms first and enzymes first before you ever use an antimicrobial. You have to like prep the land first, then you can wipe stuff, then you have to seed, and like a lot of time people have to go through cycles with it. So I think it can be helpful to know exactly what organisms are there and exactly what people are low in, because then you can get very specific with probiotics, or figure out if a probiotic would make things worse, which it can make things worse depending on what people are at. And I remind you, I'm like, if you're bloating from Brussels sprouts and garlic and onions and normal foods, probiotics are not your friend.
You want to bloat more?
Yes.
Then take a probiotic. Yeah.
Yes, or a lot of people will take it when their gut lining is super inflamed, when they're in like an autoimmune flare, and then it actually makes you more inflamed. So it's like there's this nuance and like this order of operations to things. But yeah, I think just knowing the different tools that are out there is probably the most challenging part of being a functional practitioner. And a lot of practitioners or clients will get fixated on like one specific tool and think that's the answer, when really it's like none of those labs tell you everything you need to know. All of them have mistakes and misreads and false negatives and things like that. And so I think mixing the labs together, listening to your body first and foremost over anything, and focusing on your action steps is really the best approach. And knowing like you can do a lot without labs, but if you're one of those chronic cases that nobody's been able to figure out, then they can be helpful. But also most of the time in those chronic cases that nobody can figure out, I feel like those are the cases where I take them down to the bare minimum and we go back to just like cellular health, and we usually cut their supplements down a ton because their liver's overwhelmed. We work on their mindset and their emotions to get their cellular lining balanced. And then we can start bringing things back in, but it's usually way less than they're doing.
Do less.
Do less overall, but do more of the right thing at the right time.
That's a fair statement.
Yeah.
Okay.
But just trust your body. The body's designed to heal. Just remember that.
Yes. I have to touch on one more thing, even though what time are we at?
51.
Okay. One more thing.
Yeah.
Hologram concept.
Okay.
When I first read it, I had no idea what that meant. So I actually had to do research on that. So what does that actually mean?
Sure.
Because you talk a lot about it.
Sure.
So.
Yeah, always good to end with some woo. So when I started studying biology, you realize that to understand biology, you have to understand chemistry. And to understand chemistry fully, you have to understand physics and like really start going to like the electron level. Yeah. And then to really understand physics, you have to understand quantum physics. And quantum physics, I remember I used to struggle with because I felt like Newtonian physics and quantum physics battled each other. And then I had a mentor that pointed out that quantum physics just fits Newtonian physics under a larger model. And I was like, oh, Newtonian physics is quantum physics. Got it. The reason that I bring up quantum physics with a question like that is because when you start studying that stuff, you start perceiving reality differently. And this is the whole concept of manifestation that people talk about. And like, if you focus on the right things and you have your energy in the right place, it's going to bring that thing. Dr. Joe Dispenza has a lot of research on this now. Like, this is no longer debatable. Like, this is a thing. And people are changing their bodies simply by focusing on things with their mind alone. So when we talk about like the body as a hologram, and I go back to that concept of muscle testing, where if I'm like testing a weak muscle and your body wants a nutrient so much that it actually strengthens that weak muscle, that is the hologram concept, where it's like this thing is affecting the whole system. So the hologram being your body is this complete interconnected system. So when we talk about holistic care, it goes back to the mental, chemical, and physical bodies that we were talking about. Mental, I kind of encapsulate like our spiritual, energetic body with that too, right? Because it kind of runs it all. But the hologram is basically all of these together. So when you do one small thing to one of them, it affects all of the rest of them like a mirror. So that's why when you work on the gut, your eczema heals, because it is a hologram. It's a mirror. It's this thing that affects everything. So just, it's the concept that one thing that you do in one area affects everything else. And one thing that you do in another area affects everything else. But really, this should be empowering to people, because that means that one small thing that you do affects the entire system. And so if we can start understanding ourselves like this, you now realize why meditation work affects things like autoimmune so dramatically and everything that we've been talking about. And so if you can make time in your life to tune the radio station that your hologram is attuned to. That's basically what meditation is, right? It's tuning the frequency of our brain, this thing that exists outside of our head, because they can measure it with a magnet that doesn't touch our head. And you're tuning your Wi-Fi and then bringing it back into your body and then using that tuned signal to signal all of your cells. I think that is the simplest way I can explain a quantum hologram.
Yeah, no, it makes sense. It makes sense to me, so it should make sense to everyone else.
Sure. Well,
Yes.
and even as a practitioner, it's always interesting, like learning different bodywork techniques and stuff from different people. But they would even talk about, like, there's this way, like in chiropractic, there's this way that you can line up the body. And this is how I adjust, right? Especially as a more petite person, I have to. It's like using levers and biomechanics and tensegrity components of the body. But there's this way where you can set up the body so that when you do an adjustment, it goes through the entire system. And the way that we're thinking about it is we want it to literally go through the hologram. So like if you set up all the fascia right, it'll go in one area, it'll go through all the different points of fascia you've lined up, and then it'll end up somewhere else. And sometimes if you can get the signal and the movement that aligned globally, it then like affects their energetic body. And so that's the hologram applied from a physical component. So you can do it from chemical, mental, or physical.
Super interesting. Okay. Well, we could go another couple hours, but
Well,
I think that's a good end point.
thank you.
Yeah, absolutely. Thank you.
We
should definitely do this again.
Sure. I can nerd on this stuff any day.
Yeah.